Go ahead.
Hello, a very good evening, and welcome to today's FB Live session. I am Dr. Nilesh Balkawade, Clinical Head at Oasis Fertility Pune. Pune, we have our two centers, one at Wakad and one at Kharadi, which are completely dedicated to fertility and issues with fertility. Friends, every Monday we come with a FB Live session, which is dedicated to some or the other problem related to infertility. And this month, April month, is our third anniversary month. So my best wishes from Oasis Fertility Pune to all of you. And on this third anniversary of Oasis Fertility Pune, we would like to launch an initiative which we are going to launch it on 27th of April, which is our day dedicated to the launch of this program with some personalities, renowned personalities in the field, and also some personalities who are doing social work. So with them, we'll be launching this initiative, and that is called as Chuppi Todo, where we want people to speak about their infertility problems and more so related to male infertility. Friends, Chuppi Todo is our initiative dedicated to male infertility, and where we want men to realize that the problem of male infertility does exist and the treatment is available. Multiple treatment options are available, and therefore they need to speak up first so that as doctors we can suggest you treatment. So with this background, I would like to come to today's topic, and the topic for today is obesity and male infertility. Obesity is a pandemic now in India, and almost many men are obese for their age. And this starts with the adolescent obesity or childhood obesity. The change in the lifestyle, more addiction to digital media, that is the mobile phones, laptops, and addictions to that in the childhood, less of outdoor activities, change in the eating habits, all this has led to a pandemic of obesity in India. India is recognized as the world capital of diabetes, and soon it will also be the world capital of obesity. Obesity or overweightness is basically defined as body mass index of more than 30 kg per meter square. It means the proportion of your height and weight that is calculated, and with that calculation, if that BMI or body mass index is more than 25, we call it as overweight, and if it is more than 30, we call it as obese. Those men who have BMI more than 35 are called as morbidly obese and are at a risk of more complications than any other men. Friends, obesity affects in general all of your health. It causes sluggishness in your activities, sluggishness in the thought process, but internally it's going to affect you, increase risk of cardiovascular diseases, increase risk of hypertension, diabetes mellitus, increase risk of uh, problems with the heart, some important cells like the liver cells, important cells like the male fertility cells, that is the testicular cells, and the sperm cells. The obesity is going to affect all this. So friends, we are going to see how is male fertility being affected by obesity. So if we see, obesity is associated with a reduced fertility potential in males, increased visceral adiposity, that is the fat deposition in organs. It affects the steroidogenesis, and it also affects the spermatogenesis, that is the sperm formation process. It can cause testicular dysfunction. It can cause dysregulation of hormones because of the increased fat cells. Metabolic comorbidities also exist in this male. So hyperinsulinemia, hyperleptinemia, then systemic inflammation, overall inflammation in the body, and oxidative stress. These are all going to increase because of obesity. And if the obesity is improved, we are going to find a reversal of these problems, and the fertility can also improve if the obesity is going to improve. We are yet to evaluate the problems which this is going to cause. But the mechanism of inflammation, the oxidative stress which is there, it's already proven that it causes problem with the sperm count, sperm motility, and so on. The role of antioxidants is there, but the role of immunomodulation yet remains to be studied. And there are multiple problems which obesity can have. It can have the problem with the GnRH hormones. It can have other problems, leptin resistance, insulin resistance, physical disorders, systemic inflammation, and so on. What are the causes of obesity? In general, childhood obesity, adolescent obesity can lead to adult obesity, but increased sedentary lifestyle, that's a very important cause. Psychological stress, overeating, and again psychological stress, that is a vicious circle, and this can cause a problem. Overnutrition is a problem. Increase foods with high glycemic index, that is the foods which are sugary foods or oily foods, these are going to cause obesity. Smoking and alcohol put you at a risk of obesity. Some medicines can also put you at a risk of obesity. So these are the problems. Now, what are the short term and long term complications associated with obesity? So short term, as I described, it is going to cause you problems in your day to day life, day to day activities, in your thinking process, and so on. But long term, it's going to cause you cardiovascular disturbances, neurological disturbances, then genetic and epigenetic changes can also occur. So not only the obesity is going to cause problems in you, but probably it is going to pass on the same problems to your offsprings as well. And therefore, this is very, very important that we know about how to manage these problems. So basically, if we see the impact of obesity on male reproduction, in that the hypothalamic pituitary gonadal axis which is there. So the axis, that is the hormones which are secreted from the hypothalamus and the pituitary, which act on the testicular testis to cause a good secretion of sperms and other testicular hormones. This is going to get affected, and this basically is going to cause a decrease in the sperm count, problems with the sperm motility, morphology, and so on. The testicular steroidogenesis, that is, the testicular hormones are affected because of this, and therefore a hypofunction of the testis can be seen. Then there can be metabolic hormonal disturbances like the insulin levels, the leptin levels, and the oxidative stress, and other hormones can be affected. So these are going to again cause an impact on the function of male reproductive system. Spermatogenesis is quite importantly affected because of obesity. In seminiferous there is a steady state which is there, and there is the balance of hormones has to be maintained. And because of this obesity, this balance of hormones is gone. The apoptotic process or the cell damage process increases, the oxidative stress increases, and this is going to cause problems with the spermatogenesis. Even this is replicated in the semen quality and the sperm quality as well. So this, not only this, not only the obesity is going to cause oligospermia or decreased sperm motility, that is asthenospermia, but also it is going to cause problems with the sperm DNA integrity. So uh, even if the count may be normal or the motility can be normal, sometimes the sperm DNA integrity or the DNA function can be adversely affected because of obesity, and therefore more DNA fragmented sperms can be there. And as we all know, that high DNA fragmented sperms can cause problems with the fertility. There can be rise in the male infertility cases, and also these patients might have failures of treatment or increased risk of miscarriages, which is there because of the problem with the sperm DNA integrity. If we see uh, the IVF results when the patient is obese, the obese men tend to have little bit poorer IVF or artificial reproductive techniques outcomes. So the ART outcomes are affected because of obesity. Not only this, obesity, it has been shown to induce genetic and epigenetic changes in the embryo, and this can cause future obesity and future problems with the offspring which is going to come there. With this in background, multiple problems not only with the sperms but also with sexual function. We mm, know that this is an established fact that obesity is going to cause problems with men. Friends, how we are going to treat this is to make yourself aware that you are going into overweight state or you are going to obese state is very very important. So recognize the problem is very important. So if your body mass index, which is a very simple calculation, so your weight in kg upon your height in meter square is what will give you the body mass index. And if you calculate that body mass index, and if your body mass index is below 25, you need not worry. But once your body mass index is above 27, you fall into an overweight category. And if your body mass index is more than 30, it's a obesity. More than 35, it's a morbid obesity. And these are going to cause problems. So this is very important test. Along with that, we can do certain blood tests to see if the lipids in your blood are very very high. So the LDL levels, the triglyceride levels, the HDL levels, all these are very important to be studied in a patient of obesity. Not only this, obese patients are prone to more hypertension and decreased glycemic control or diabetes mellitus. So you need to test these problems as well. Sometimes the cause of obesity is in thyroid disorders, so thyroid function tests can also be taken in these men. Along with that, ultrasonography will help you to tell whether there is a very visceral component to the obesity. So the cause and the effect of obesity needs to be tested when it comes to the tests. Now we come to the treatment part. Friends, when it is obesity and male infertility, we need to treat both. We need to treat the obesity component first. So lifestyle modifications are an important form of treatment when it comes to obesity management. So a good diet, which is less in simple carbohydrates, less in the high foods which are having high glycemic index, is very very important. You can have complex carbohydrates in your diet. A diet which is less of carbohydrates and more of proteins is again beneficial. Diet Obesity is going to cause a generalized state of inflammation all over the body, and this is going to impact right from your brain till to your toe. So right from the head to the toe, the organs can be affected, and therefore it's very very important to reduce this inflammatory state by use of certain antioxidants to reduce the oxidative stress. So lots of fruits, lots of salads, lots of water, liquid intake, lots of foods which are natural are going to help you. Avoiding foods which are processed foods or packed foods which are going to have chemicals will add to your problems of male infertility. So friends, a very good balanced diet is very important, and once you want to decrease weight, you can take a dietitian's help for that. Aerobic exercises are going to help you to decrease your obesity, to decrease the insulin levels, to decrease the leptin levels, and so on. Therefore, aerobic cardiorespiratory exercises are very, very important when it comes to obesity management. So, half an hour to 45 minutes daily exercise should be there to reduce the fat burden and obesity. Increasing the muscle strength is also very important. Along with that, a regular sleep pattern is very, very important to keep your body healthy. Keeping away from addictions is also, again, an important part of lifestyle modification. If you are suffering from some problems such as high lipid profile or high sugar levels or high blood pressure, you need to take medicines, because if you deny that and if you are just you will just say that no, this will get cured by some natural ways. It may not, and it can cause problems with to your important organs, that is the vital organs. So it can affect your vital organs such as brain, heart, and kidney. So this is very very important to take certain medications if it is indicated. Friends, this was about lifestyle modification. Next comes is the medicinal management. So there are certain medicines which can be used to decrease obesity, and also certain medicines which will improve the male infertility component. So antioxidants are very important when it comes to male infertility, and a 3 to 4 months of antioxidant treatment is indicated to manage the problems which are caused by obesity, to improve the semen parameters, and so on. Of course, obesity management also requires certain medications if it is not cured by lifestyle modifications, and you can take expert opinion, an obesity consultant's opinion for that. Once these diseases are not cured and it's a case of morbid obesity, then we have surgical treatments to obesity as well. So surgical treatments such as bariatric surgeries, minimally invasive surgeries for obesity can cure. It has sometimes shown that uh, sudden weight loss is not recommended, especially when you are taking fertility treatments. So you can have a consultation with your fertility specialist and your bariatric surgeon once you're planning pregnancy, because it may sometimes adversely affect if you reduce the weight too drastically. So follow a planned approach, meet your specialist, and get yourself treated so that the impact of obesity will be less on your fertility. So as men, please meet experts, chuppi todo, speak out, and help yourselves. Thank you so much for your patient hearing. And any questions related to male infertility and obesity, we will be happy to answer. This is our helpline number, which is given below. Or you can directly walk into our centers at Wakad and Kharadi in Pune. We have 30 centers all over India where you can visit. So, thank you. And that's it from today. I, Dr. Nilesh Balkawade, Clinical Head, sign off. Thank you so much. We can close the session, Hema Bindu.